Very good evening, ladies and gentlemen. Welcome to yet another episode of Perceptive Learning Zone. And today we will be talking further on the topic of AI in diagnostics. So, talking about diagnostic AI, well, as we talked about it in the last video, the healthcare sector, it is poised for a revolution. And you have artificial intelligence, which is playing a very pivotal role in transforming how we diagnose and treat diseases. So AI's ability to process vast amounts of data quickly and accurately, it is reshaping the landscape. It's offering new ways to improve health outcomes globally. However, building effective and accurate solutions that are, I would say, culturally sensitive and inclusive, well, that requires collaboration across the plethora of needed skill sets. And the result is better and faster access, to health solutions. So what exactly is this promise of AI in healthcare? You see, AI's potential, ladies and gentlemen, in healthcare is vast. It ranges from predictive analytics and personalized treatment plans to improving diagnostic accuracy. Now, the sheer volume of medical data that is generated daily from patient records, clinical trials, medical imaging, as well as wearable devices, this can be overwhelming for human practitioners. Now, as AI fellows can analyze and learn from this data, patterns and correlations that may go unnoticed by human eyes, they can be detected. And this leads to earlier and more accurate diagnosis, which is crucial in improving patient outcomes. Now, one of the most promising areas of AI in healthcare is in diagnostics. You see, traditional old school diagnostic methods, they often relied on the on the subjective interpretation of medical professionals, which can sometimes result in variability in outcomes. Now, AI can reduce this variability by providing consistent data-driven insights, hence which leads to more, I would say, reliable diagnosis. Now, collaboration is the key to robust AI healthcare. It is essential for creating effective, ethical, and impactful solutions to the world's most pressing challenges, whether that includes AI engineers, data scientists, or domain experts. These are the words of Ruth Mitra, who is the CEO of Omdena, a collaborative AI platform, and she says, quote, that such kind of collaborations across people from different sectors and regions, they help build more ethical and trustworthy AI solutions, unquote. Now, in the healthcare sector, Omdena is applying AI to diagnostic processes, particularly in underserved communities. Now, these models, fellas, they assist medical professionals in identifying diseases more accurately, such as tuberculosis and diabetic retinopathy, and at earlier stages, thereby increasing the chances of successful treatment. Now, these projects involve training AI algorithms on large data sets of medical images. Taking a collaborative approach, it ensures that AI models are robust, culturally sensitive, as well as adaptable to various healthcare settings. Now, the World Economic Forum is also driving digital healthcare transformation by fostering a global multi-stakeholder approach to accelerate the responsible integration of digital health solutions into healthcare systems worldwide. So, by collaborating with governments, business, and civil society, the forum is focusing on improving healthcare access, improving healthcare outcomes, enhancing equity. How? Through innovative technologies while addressing challenges like data privacy, cybersecurity, as well as, obviously, you guessed it, the ethical use of AI in healthcare. And I feel like by integrating the AI models into healthcare systems, particularly in regions with limited access to specialized medical professionals, we can democratize healthcare and ensure that more people have access to early as well as accurate diagnosis. So, What about diagnostic AI's impact on the health outcome? That is another factor. You see, early diagnosis, fellas, you would all agree, it is the key to successful treatment. Now, diseases like cancer, for example, they have a significantly, they have a significantly higher survival rate when detected early. And when breast cancer is detected at stage 1, the 5-year survival rate is over 90%. Similarly, you talk about colorectal cancer. It yields a 14% 5-year survival rate when diagnosed in later stages. But this can go up to 90% with early diagnosis. Yes. So therefore, it's not wrong to say that the impact of AI-driven diagnostics and health outcomes, it cannot be overstated. And this not only improves patient outcomes, what we see, but it also makes healthcare more accessible. And it reduces the burden on healthcare systems by preventing the progression of diseases to more advanced stages, which are often more difficult and expensive to treat. For example, Omdana's, the person we just talking about, the person's AI-powered lab in Liberia, it is predicting malaria outbreaks. It is identifying high-risk areas. It is enabling health officials to take proactive measures, particularly for vulnerable groups such as children and pregnant women. Now, AI is also transforming oncology by enabling personalized cancer treatments through genomic analysis, by identifying mutations and tailoring therapies to a patient's unique cancer profile. This approach is going to improve treatment efficacy. It is going to reduce the side effects, and more importantly, it is going to accelerate drug discovery. And also, I think it's important that I add over here that artificial intelligence, ladies and gentlemen, it has also been used in the early detection and prediction of cardiovascular diseases. Machine learning is used to analyze ECGs, medical imaging, as well as patient data, with studies having shown impressive accuracy rates, including a heart disease classification of 93%. So it's not wrong to infer, as a corollary, we issue this statement, this verdict, that AI is improving diagnostics. It is offering non-invasive methods for assessing cardiovascular risks, potentially saving many lives in the process. So what is the future of AI in healthcare? You see, as AI continues to evolve, its role in healthcare will only become more critical. The ability to predict, diagnose, and also treat diseases with greater accuracy and efficiency. It will lead to healthier populations and more sustainable healthcare systems. And the mission is not just to build AI models. It's about creating solutions that are inclusive, that make a real difference in people's lives. And this principle, it took center stage at one of the United Nations General Assembly's health hearings, as representatives discussed how best to accelerate action on the United Nations 2030 agenda. And chief among these priorities, you could say, that was the focus on universal health coverage and pandemic preparedness. The shared learnings from COVID-19 have cemented the invaluable role that decisive global action plays during international health emergencies, and it has prompted countries to take immediate measures to strengthen health security. This is even more pressing, I would say, in low and middle income countries like Pakistan, for example, that grapple with capacity as well as capability challenges, where there is an absence of uniform regulatory mechanisms, as well as the added challenge, I would say, of rapidly growing patient populations, not to mention a sharp rise in the number of elderly, even though we are still comparatively a young country. So we can no longer sideline achieving sustainable development development and global health security. We must follow this world vision with urgent interventions. More importantly, we the people must acknowledge that no one can do this alone, sir. Collective action is needed to address the critical areas and support the implementation of critical policy and guidelines in conjunction or in accordance with the World Health Assembly Diagnostics Resolution and the 2030 goals. So obviously, collaboration among private and public stakeholders is essential. And also to give more context, Asia Pacific, which is home to 60% of the world's population, it has work to do when it comes to helping the world achieve universal healthcare. The Southeast Asia region has the highest level of out-of-pocket spending as a share of current health expenditure among all WHO regions. In 2017, Southeast Asian region had 117 million people facing poverty due to health spending. And with less than 7 years until the 2030 deadline, achieving universal healthcare is an undeniably tall task. But you know what, fellas? It is further complicated by the fact that 47% of the world does not yet have access to even the most basic diagnostics. Through necessity, that is brought on by the pandemic, we have seen a surge in diagnostics innovation, approval, as well as distribution. Despite this, diagnostics currently makes up just 2% of the healthcare spending. Life-changing innovation is, we have to understand it is only meaningful if it reaches those who actually need it. Diagnostics must play a more central role in national healthcare plans for crisis preparedness, for routine healthcare services. The Asia Pacific now, it bears a substantial global burden of infectious diseases and the prevalence of non-communicable diseases like cancer, like cardiovascular diseases, which are adding to the health system's already growing list of challenges. So this mandates or necessitates, I would say, a more prominent role for diagnostics, not only as a means to facilitate treatment, but also as a gateway for early intervention, preventing the disease from getting worse and detecting it before it even starts. This early intervention approach, it pays dividends in better patient health outcomes and long-term cost savings for healthcare systems. A clear case for this is in breast and cervical cancer, where targeted and sustainable interventions by emerging economies in the Asia Pacific can help to accelerate their progress towards WHO targets for both diseases, as also highlighted by the Asia Pacific Women's Cancer Coalition report. So we have to move forward, I would say, cooperatively. Yes, it is very important. And I feel like, we gotta be motivated for that. We gotta stay optimistic, and ultimately we should be raising our vision to match our faith rather than downgrading our dreams to match our reality. Thank you very much, fellas, and stay blessed. Assalamu alaikum.